can see that it is the double bone, it's not single. For example, mandibular, it is single bone. Maxilla, it is the double bone. And between right and left bones, we have the raphe, bone suture, which is connected, these two bones, to each other. Also, they connected to each other by palatine process of the maxilla, which forms the roof of our oral cavity. Let's say, my friends, look everybody on the maxilla. This is the real position of it. Maxilla, my friends, has the body. This is the body of the maxilla. And maxilla has the processes. Now I will show for you this. Let's say this is the body of maxilla, and there are several processes. First process of maxilla we call the frontal process. It goes to the frontal bone and connected with it. Let's say frontal process of the maxilla. Second process of maxilla, you can see it is connected with zygomatic bone. We call it zygomatic process of the maxilla. Third process of maxilla, it's look to downwards. It is place of location of upper tooths. We call it alveolar process of the maxilla. And finally, last process, it forms the, like I say, roof for our oral cavity, and we call it palatine process of the maxilla. Let's say once again, remember please, maxilla has the body, the middle part, and it has four processes: the frontal process, zygomatical process, palatine process, and alveolar process. For the maxilla, my friends, we describe also three surfaces. Anteriorly to the body, we have the facial surface, which is look to the face. Upper part, which is look to the orbit and form the inferior floor of the orbit, we call the orbital surface. And the back one, which is look to the temporal region, we call infratemporal surface. Just 2 minutes before, I show for you fossa infratemporalis, which is located below. And you can see that anteriorly, it is bordered by the body of maxilla. That's an infratemporal surface. Once again, facial surface, orbital surface, and infratemporal surface, which is located here. Let's continue, guys. This is the most important structures. But now we will start to discuss everything which we have here. Look here, please. Then, in the place of connection of two maxillary bones to each other, we have the prominent part, which is looked anteriorly. We call it anterior nasal spine. This is anterior nasal spine. This all incisura, which you see, look here please, it's great visible here. All these big notch, nasal notch, it is nasal notch. If you will look to inside, you will see that here there are protrusion of the bone, which we call nasal crest, crista nasalis, that's it. Nasal spine, nasal notch, and nasal crest, crista nasalis. Now let's look to the inferior surface. Foramen incisivum, which is located just in anterior part of our palatine process. Look here, please. Posteriorly, we have the good visible groove, which is place of connection. Yeah, here it's not so good visible. Look. Look. Place of connection between two bones. It is maxillary bone and it is the ethmoidal bone, which I will tell you now. Ethmoidal bone, that's why we call it maxillar ethmoidal sulcus, maxilla ethmoidalis. If we will look anteriorly, guys, in the body part, just below the orbital, infraorbital margin, you will see depression. We call it fossa canina. And in midpoint of fossa canina, you will see aperture, which we call infraorbital aperture. Infraorbital aperture has great meaning. From this aperture, arteria infraorbitalis come to outside, and nervus infraorbitalis, which is branch of nervus maxillaris. Here they forms very important vessels, which is supplied upper tooths and innervated upper tooths. Remember, please. Let's continue, my friends. Now, if you will look to orbital surface, in the orbital surface you will see very good depression, very good visible groove, which we call orbital groove, and it is continues to downwards by the canal. It is place of passage of important vessels and nerves. Again, orbital structures is posterior, fissura orbitalis. We will discuss it after, then we will study vessels and the nerves. Now, if you will look in the medial surface, my friends, you will see big air cell, which is located inside of it. We call it the sinus of the maxilla. And by author, we call it the Hymorian sinus. Let's say we come to the conclusion that maxilla, it is the bone which has air cells, like the ethmoid bone, like the frontal bone, which we studied before. Let's say we have the sinus cavity. This sinus connected with the nasal cavity. By its aperture, it is connected. Unfortunately for us, guys, the sinuses can be easily inflamed. We call the problem sinusite. Why? Because in nasal cavity we have non-sterile environment, and if infection will be spread into sinus, it will give the formation of sinusite. Why it is heart problem, guys? Because inside of the sinus we have only very slim mucous membrane. We don't have soft tissues. Let's say antibiotics can't normally reach to this space. Let's say for treatment, my friends, we make the puncture of the sinus. From the bone, we make puncture of sinus, or from inside also. So in mucous membrane, we make puncture of the sinus and remove the pus and wash the cavity by the solutions of antibiotics. Again, I say, because naturally, normally, by the vessels, antibiotics can't reach normally to this space. And also we have inner groove, which is perpendicular just below our sinus. It's great visible. It is crista concha. It is place of connection with inferior nasal concha. You remember superior and middle nasal conchas. Yes. It is part of our ethmoidal bone. Inferior nasal concha. It is part. It is separate bone. It is separate bone. Now let's come to the next one. Let's say this is our maxilla. Inside of the alveolar process, my friends, we have alveolar depressions, place of location of the roots. From the tip of each depression, alveolar canal is started. By alveolar canal, vessels and nerves through the bone come to the tooths and supply. Remember, please, vessels, it is branches of arteria infraorbitalis and arteria maxillaris. Nerves, it is branches of nervus maxillaris. It is second branch of trigeminal nerve. Trigeminal nerve has ophthalmic branch, maxillary branch, and mandibular branch. Mandibular branch innervated inferior tooths, maxillary branch innervated superior tooths. Yeah. This is alveolar process. All inferior part of the bone, where is place of location of the tooths. Let's say this is alveolar. Inside of alveolar process, we have alveolar depressions, apertures. Between if you will put your finger and palpate it, you will see it's not smooth. Here we have alveolar grooves and alveolar yolks. You remember the yolks we have on the inner side of the. Let's say the protrusions, it is yolks. Between yolks, we have the grooves. Okay?
What is this fossa?
This is Palatine process.
This fossa?
This fossa we call foramen palatinum major and canalis palatinus major.
Okay.
It is located in posterior. Here we have nervus palatinus major, which is from nasal cavity come to the oral cavity.
Yes.
So, sir, the gums are actually the alveolar that.
Once again.
The gums.
Yes.
Of the teeth.
They cover the alveolar process.
Okay.
Of course, from oral cavity, gums cover the alveolar process, and for upper and for lower bones. Upper bone is maxilla, lower bone it is mandibular. Because time is very short, quickly I will try to represent it for you, all these bones. All another peculiarities you will find. I will give the most important questions. The mandibular. Mandibular, my friends, has two again parts. It is the body and it is the processes. Body of the mandibular has two parts, horizontal part and the vertical part. On the vertical part, we have two processes. Anteriorly, we have coronar process of the mandible. Posteriorly, we have condylar or articulation process. On the horizontal part, we have alveolar process. Let's say two processes located in vertical part, one process located in horizontal part. Between horizontal and vertical parts, we have angle of the mandible. It's great palpable. This is place of attachment of our masseter muscle. Masseter muscle start from zygomatic arch and finish in the angle of the mandible. It is the main mastication muscle, the biggest mastication muscle, chewing muscle. Now look please everybody here. In anterior part we call it the chin part, yeah? We have the protrusion, eminentia, and from two parts, eminentia is single. In two parts of eminentia we have tuber mandibularis, which we can easily palpate. Little bit behind of tuber mandibularis we have aperture. We call it foramen mentalis. Foramen mentalis, it is the final part of mandibular canal, the canal which is passed inside of it. If you will look on the inner surface, in the place of this metallic wire, we have the, this is factor, actually it is the exit of the canal, it's finished. This is the entrance of the canal. That's a canal started by this aperture, which we call foramen mandibulare, and then continue inside of the bone, we call it canalis mandibularis, and it is finished by foramen mentalis. Inside of this canalis mandibularis, we have important artery and nerve. It is arteria and nerve alveolaris inferior. Through the alveolar processes and artery and nerve gives the branches, which is passed by canalis alveolaris, come to the alveolar depressions and supply the tooth which is located in inferior part. That's an inferior tooth. Between alveolar depressions we have septus, which is divided alveolus into several pockets, the place of location of the roots. If you will look attentively on the inner side of the mandible, you will see the oblique line which is located and in horizontal and in vertical part. We call it linea mylohyoidea, mylohyoid line. It is place of attachment of the mylohyoid muscle. This is my mylohyoid muscle, which forms the floor of my oral cavity. Let's say this muscle we call the diaphragm of oral cavity, because inferiorly it is close to the oral cavity. Now let's come to the processes. Like I said you before, there are two processes on the vertical part of the mandible. Posteriorly we have the condylar process. You can see that head of condylar process located just inside of foramen mandibularis of our temporal bone, and with temporal bone together it forms the joint. Temporal mandibular joint. This is the joint which make our mandible movable. And by my friends, by constriction of our mastication muscles, we will have mastication, chewing. When we say mastication, we imagine not only this movement from down to up, but only movement from anterior to posterior and movement to the sides. Let's say we have not one, but we have 4 mastication muscles after we will study. It is the temporal one which make this movement. It is the masseter one which make this movement. And it is pterygoid muscles which is located inside to vertical part, and they make the movement to the sides. Let's say remember please, by our temporal mandibular joint we can have mastication. Let's say this is 4 different movements. In front, behind, up, down, and to the sides. Between these two processes, we have the incisura mandibularis. Incisura mandibularis, it is, we can say, the aperture which is connected fossa infratemporalis by the mandible, and by this incisura vessels and nerves from infratemporal fossa, we've come to the mandible. Why it is necessary, guys? Because exactly here we will have parotid gland. And these vessels, it is arteria vena parotidea and nervus parotideus. They will come to the parotid gland and will innervate it and supply. Let's say, remember, incisura mastoidea. It's located between two processes. Inner eminentia, it is located just on the level of outer eminentia, but from inside, for both sides, we have digastric depressions. It's great visible here. Place of attachment of the digastric muscle. Digastric muscle has 2 belly. Anterior belly attached to our mandible and come to hyoid bone. Posterior belly from hyoid bone come to the styloid process of the temporal bone, which we studied before. This is the all necessary important structures of our mandible, which I want to show for you. Now next bone, guys, it is the zygomatic bone. I put it in its place. You can see that zygomatic bone also has the body, and zygomatic bone has 2 main processes. One process comes to the laterally, and we call it the temporal process. It's great visible here. temporal process. Second process goes to upwards and connected with frontal bone, and we call it the frontal process. Let's say temporal process and frontal process. Body of the zygomatic bone has triangular shape form, and in the zygomatic bone we describe two good developed surfaces. Surface which is looked to the back we call infratemporal surface. It is again looked to the fossa infratemporalis, which I show for you. Surface which is looked to upwards we call the orbital surface. It forms the part of the orbit. It is inferior lateral part of the orbit. Sometimes anterior part of the bone we call the facial surface because it forms our face. Three apertures we have in the bone. Here only one is visible. That's why I will show all the apertures in the picture. Also in this bone it is here the zygomatic facial aperture. It is great visible here. The zygomatic facial aperture. It is place of passage of zygomatic facial nerve, which is branch of nervus maxillaris. 1 minute, dear. Second aperture, look here please. To see, you will look to the orbital surface, and here there are zygomatic orbital aperture. Look, zygomatic orbital aperture. It is great visible here. And third one located just in the infratemporal surface and the zygomatic infratemporal aperture. Let's say this is three apertures. This is place of passage, the same name nerves. Sometimes inside of them we can describe on diploidic veins also. Unfortunately, next bone, Palatine bone, it's impossible to show here. Why, my friends? This is Palatine bone, and only horizontal part of it you can see. Perpendicular part of it, it's not so good visible because it is close with the another bone. But generally, it has two parts. Look here, it is perpendicular part and it is the horizontal part. It is double bone. It's formed the lateral wall of nasal cavity and upper wall of the oral cavity with the palatine process of the maxilla. Let's say, remember please, palatine bone has two big parts. It is horizontal part, which is connected with palatine process of the maxilla, and it is the vertical part or transverse part, vertical part, which is formed the lateral wall of nasal cavity. Now sit down please, by the picture I will. The green bone, which is located just behind of it, it is the horizontal plate of the palatine bone. This is our palatine bone. You can see that it has two parts. It is vertical or perpendicular plate and horizontal plate. Vertical or perpendicular plate forms the lateral wall of the nasal cavity. Horizontal plate forms the roof for the oral cavity, together with the palatine process of the maxilla. You can see several important structures. Look please in the perpendicular plate. You can see the sphenoid process. By the sphenoid process, it is connected with sphenoid bone. It is place of the pterygoid process of the sphenoid bone. Let's say these two bones fused by the bone structures to each other. Unfortunately, I can't show it in the real skull because sphenoid bone from upwards close this place and it is invisible. The most upper part, look here please, we call the orbital part. It forms, my friends, the inferior and medial part of the orbit. It is looked to orbital cavity and we call it the orbital surface. Let's say, look here please, it's visible like the perpendicular plate finished by bulb-shaped part of the bone, which we call the orbital process, and which is one of the bones which is form our orbit. Just on the next lesson we will describe the orbit, and I will show for you all the bones, yeah, frontal bone, maxillary bone, lacrimal bone, zygomatic bone, palatine bone, ethmoid bone. On all these bones which we study, we have orbital surfaces. Let's say on our palatine bone, we also have orbital surface. Let's say it is one of the bones which is form our orbit. Don't worry now. Point by point, all these bones we will study together after. Now look here please. Inside of this orbital process, you can see the air cell. Let's say this is the sinus of the palatine bone. Let's say Palatine bone, it is also the bone which is contained the air cell, which has the sinus. Now we can make conclusion. Now we know all the bones with the sinuses. It is the frontal bone, it is the ethmoidal bone, it is the maxilla, and it is the palatine bone. All these, and of course the sphenoid one, yeah? All these sinuses surrounded the nasal cavity, and all of them have the connection with the nasal cavity. Like I say you before, we can see inflammation of these sinuses. That's the frontal bone, sphenoid bone, ethmoid bone, palatine bone, and maxilla. This is the bones of the skull with air cells, which we call sinuses. Remember, please. Now look here, please. In the next picture, you can see, my friends, the posterior surface of the perpendicular plate, and it's great visible, a good developed groove, which is located here. Look here, please. It passes from up to the downwards. We call it sulcus pterygoideus, the pterygoid nerve pass. You remember the same sulcus pterygoideus we have in the sphenoid bone, in the pterygoid process. Let's say from sphenoid bone, it is come to the palatine bone and passed by inferior surface, by and finally, my friends, you look here, please, by aperture, about which you ask me, foramen pterygoideum major, greater palatine aperture, foramen palatinus major. This nerve come to the oral cavity. That's it. From cranial cavity by canalis pterygoideus come to the groove on the pterygoid process. Then it is continuous to the same name groove in the palatine bone, and finally to downwards by greater palatine aperture. It is come to the oral cavity and make innervation inside of the oral cavity. Remember, please. This is about sphenoid bone. Next bone which I want to describe you, it is os lacrimalis. Look here, please. Again, this is the bone, very small bone, which is involved in the structure of the orbit. It forms the medial wall of the orbit. You can see it. On this bone we have depression, which we call fossa lacrimalis. Here we have the lacrimal glands. One lacrimal gland we have in frontal bone, you remember. Again, lacrimal depression. And second one we have in the lacrimal bone, fossa lacrimalis. Let's say, remember please, we have not one lacrimal depression, but two. One, it is located in the lateral part of the frontal bone. Second, because in medial one we have trochlear depression, yeah? Second, located just on the lacrimal bone, which is formed the medial wall of the orbit. Bone has also the crest. Crest is located just in the behind of our orbital surface, the place of connection between ethmoid bone and lacrimal bone, place of formation of this bone suture. We call crest of lacrimal bone because it has the sharp margin here. Let's say by this sharp margin, lacrimal bone from behind connected with the ethmoid bone. Here, guys, you can see mainly in our next lesson elements, yeah, the bones which is form our orbit. You can see, yeah, superiorly it is our frontal bone, laterally it is our zygomatic bone and maxilla, medially it is our ethmoid bone and it is our lacrimal bone, and a small portion of the palatine bone, yeah, which I say your orbital surface of the palatine bone just before I show for you. And my friends, posteriorly and laterally, you remember it is greater wing of the sphenoid bone, which is forms here the fissura orbitalis superior and fissura orbitalis inferior. Superior forms between greater and small wings of sphenoid bone. Inferior forms mainly between maxilla and greater wing of the sphenoid bone. By this aperture, vessels and nerves come to orbit and goes from orbit to inside, especially nerves. Last bone, which are last two bones, it is next one, it is single bone, which we call the vomer. Look, everybody, it is inside of the nasal cavity. You can see the bone septa of the nasal cavity, which is divided our nasal cavity into two parts, right and left. Superiorly, you remember, it is our perpendicular plate of the ethmoid bone. Inferiorly, with perpendicular plate of ethmoid bone, connected next bone, which we call vomer. Let's say, like you can imagine like this. Superiorly, we have the perpendicular plate of the ethmoid bone. Inferiorly, we have the vomer. Together they connected to each other, and together they form the complete septa inside of the nasal cavity, which is completely divided nasal cavity into right and left parts. Again, I can't show the vomer better in these skulls because all another parts is close. But if you will look on the picture, my friends, superiorly you will see so-called wings of sphenoid bone, of vomer. And between the wings, look at please, superiorly, we see the wings. And between the wings, you see the groove, very good developed groove. My friends, it is the place of connection with sphenoid bone. You remember sphenoid crest and rostrum part. Yeah?
Yes.
They will be inclining exactly inside of this groove of the bone.
Okay.
That's a crest of sphenoid bone. Look to downwards, look to the groove, which is located between the wings of our cell. Inferiorly, our sphenoid vomer connected with palatine processes of our mandible and to the horizontal plate of our palatine bone. Let's say inferiorly it is connected with maxilla, sorry I say mandible, maxilla and palatine bone. Superiorly it is connected with the sphenoid bone. Again, I say you together with perpendicular plate of ethmoid bone, it forms complete septa inside of our nasal cavity. Nasal cavity has two septas. Anteriorly it is the cartilage septa. Posteriorly it is bone septa. The cartilage septa we will study together after. Then we will speak about soft tissues. Nasal septa, you understand, superiorly here. We have the perpendicular plate, inferiorly we have the vomer. Vomer inferiorly connected with maxilla and palatine bone, superiorly with sphenoid bone. It is single bone. And finally, my friends, look here please, last bone which I want to give you, look, sit down please, I can't show it in the skull. Look here, please. Hyoid bone, it's not so good palpated, by the way, because it is covered by muscles which form the diaphragm of oral cavity. Let's say it's located just below the tongue. And inferiorly it is connected with the larynx, with the membranes of the larynx. And superiorly it is place of attachment of the muscles, which is formed the diaphragm of oral cavity. Let's say muscles which is formed the tongue and diaphragm of oral cavity, connected with this bone. Bone has three visible parts. It is the body of bone and two horns. Posteriorly we have big horns, anteriorly we have small horns. Corno superior horns and corno inferior. That's three parts. You will remember please, let's say this is the body, anterior part. Just up to the body we have lesser horns, and posteriorly we have the greater horns. My friends, greater horns connected with membrana thyrohyoidea. It is the membrane, white membrane, which is gray visible here, which is connected thyroid cartilage. This is our thyroid cartilage with our hyoid bone. This is membrana thyrohyoidea. It starts from thyroid cartilage and it is finished on the level of hyoid bone. Hyoid bone, greater horns, also place of connection of digastricus and stylohyoideus muscles. Let's say these two muscles will connect it to the greater horns of our hyoid bone. It is place of its attachment. Let's say this is your homework, my friends. All the bones which we have in viscerocranial, all of them with all the necessary pictures I put here. Let's say, and inner side is visible, and outer sides look so good visible. Here we have alveolar depressions. Samely, they have same structure, and for maxilla and for mandibular. And you can see the septa alveolaris, which is divided fossa alveolaris to each other. How many times we have